Want to know what it takes to be a good practitioner? In today's podcast, my dear friend Heather Hannam, a physical therapist of 45 years, shares her holistic approach she uses in her practice to successfully treat her clients.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Welcome to this episode, everybody. I'm so excited to share with you our guest today. We have Heather Hannam with us. Heather is a physical therapist out in Oregon. She's been one for 45 years. She is a mom to 4 kiddos. She now has grandkids. She's been a childbirth educator. She has specialized in the jaw and the pelvic floor. She is the medical expert for healing the pelvic floor with Suzanne Skurlak. And she also lectures for that course as well. And Heather and I met, we were just discussing, she thinks 26 years ago. I'm not so sure it's been that long, but it's been quite a while. Heather and I met at taking continuing education courses, and I lived up in Seattle. She was down in Portland, and we really grew a deep friendship taking the visceral manipulation courses together. And the one thing that I so appreciate about, well, there's many things I appreciate about Heather, but we really connected over the personal growth that is so important to both of us. And I have always just been in awe at Heather's ability to just be so humble and so willing to look at herself. I think I resonate with that myself. And we've just shared some beautiful, beautiful experiences in our lives, supporting each other throughout that. And, you know, I have seen Heather, in my opinion, is kind of a continuing education course junkie. I'd say you have taken so many continuing education courses. I was in awe of that. And your knowledge and depth of information from all these different areas that you have acquired over the years. And I just truly, truly value you as a clinician. And actually, I have to share that, like, you took one of my first or second postpartum courses. And you guys, it was this like, oh crap, Heather's taken all these other continuing education courses. Why would she want to come take one from me? You know? So I had a little bit of an awe moment there when you signed up to take my course, Heather. I just wanted to share. And so, you know, you reached out to me because you're just like, Lynn, I have all this information to share and I want to share it. And so I'm like, yes, let's do it, because I know you and I can have a really juicy conversation. So Heather, what is it? Welcome to this, to the podcast.
Thank you. Delighted to be here.
Yeah, I could go on and on and on talking about you, but let's go ahead and let you get in here. What would you like manual therapists to know from all your experience over the years? You have a ton of golden nuggets to share. Where do we start?
That's an excellent question, because I do have a few.
More than a few.
We'll just dive in and we'll see how far I get. I was sharing with you earlier, I have 5 pages and it's been pouring out of me. And even today, I went to mass this morning, and even today it's like, okay, you could add that.
Yeah.
So I have plenty of information. I would guess the first thing I would like to start with is a little humor, because my husband was in a very niche job, and they produced very anatomically correct body parts. And so our tagline was, he paints nipples and butts. I work the orifices above the neck and below the waist, and that either starts conversation or ends it.
Yes.
But what I would tell you is, it wouldn't matter where I went. If I went to women's teas, if I went to the makeup counter, if I went to, you know, any place where women were, they were leaning in, because the amount of information out there was pretty small for a long time.
Yes.
So first of all, I would tell you that I do a lot of personal work because I have a strong feeling that I can't, that the best I can be is what I can bring to my clients. And the more I know about me, the more present I can be with myself, and then the more present I can be with my clients. So as we were talking earlier, I like to start my day with what I call a shadow ceremony. The shadow ceremony, most of us talk about the shadow, what is in our psyche that we're not aware of. And so if I can list my fears and concerns for the day, they tend not to play out in my treatment room. And I am absolutely a better therapist on these days. And so this is an example of my shadow ceremony. Angels of protection around my doorways of perception. This is a shadow ceremony. I'll be running late. My client will run late. I'll drop things. I'll say the wrong things. I won't say the right thing. I won't be present for my own perceptions. My mind will wander. I'll fall asleep. I'll miss nonverbal cues. I won't be a good listener. I'll be distracted. I won't trust my hands. I won't trust my inner knowing. I'll get stuck in my head. I won't feel the tissues. I'll misjudge the tissues. I'll speak out of turn. I'll rush the client. I won't give them enough time. I'll forget to breathe. I'll hold my breath. My words will come out wrong. My explanations won't be correct. I'll get my rights and my lefts mixed up. I'll forget the right technique. I won't use the right technique, or I'll use the wrong technique. I'll get scared. And then, whatever pours out of me in the day, and then you close that by saying, that was a shadow ceremony. And just doing that allows me to not let those low running programs come out in my day. And I got to tell you, it's a powerful piece for me.
Wow. It reminds me, I don't know if anybody here has listened in or watched the series This Is Us. It was on, NBC, I believe.
Loved it.
And Randall and his wife would do a similar practice of that. Like, okay, let's just, throw out there all the negatives, and just like get it out there. And it's a really powerful practice because I feel, and that's why I so appreciate you, Heather, why we're such good friends, is because that is so important for me to show up as the best I can for my clients. But this naming the fear and identifying the fear, I tell my clients, especially my pregnant clients, whatever fears you don't address before going into labor, those are the ones that are going to play out. And I have seen it over and over with my clients. It's like, I really didn't want a C-section. I was so afraid of C-section. So I just didn't learn anything about it, didn't, do anything with it. And then they end up having a cesarean. And so,
they say, worry and concern is like a negative prayer.
Yeah.
And that's what you're putting out. And so, anyway, that has been really powerful for me. So I'd be happy to I shared that.
Yeah.
So I find when I decided to start a little bit on just evaluations, what I'm thinking about.
Mm-hmm.
The narcissistic needs of children and adults is to be seen, heard, respected, and supported. That's Alice Miller's work.
Okay, wait, say that again, because that is so important.
Thank you. The narcissistic needs of people are to be seen, heard, respected, and supported.
Oh, that's beautiful.
So that is one of my key ways that I look at life. And so when I'm doing an eval, I smile when I think of some of you do your work in 2 or 3 sessions. I rarely do internal work on the first day. I take plenty of time to hear their story, to listen to the tears, to ask the kind of questions that helps them feel confident in me and comfortable in me. Because I do not only, I've done chronic pelvic pain clients, I do men and women, and they've got stories. By the time they get to us, they've been living with it for years. They have their own belief systems around it.
Well, Heather, I want to interrupt there because
Sure.
I mainly see postpartum,
Right.
And so, and I have seen a couple of chronic pain patients, and you do not do internal work in a couple of sessions. You know, it may take 3, 4, 6 sometimes to get that. So, you know, I want to say that with that qualifying factor
Oh,
there.
absolutely. Absolutely.
Yeah.
In fact, I was thinking I hadn't had just a simple incontinence for years. I'd love one.
Yes. That's why I love my postpartum work, because
Absolutely. So I do a lot of teaching even while I'm evaling, and I'll give them little clues and cues along the way. You know, I always do my postural evals, and I share with them what I'm looking for and what I find. And I've had a couple of clients on the very first evals. I remember this one gentleman. I noticed that his trunk was turned slightly to the right and that one hip was high. And he said, well, why would that be important? And I said, well, things that happen in our life, you know, set us up for uh, um, changes in the posture. And then he sits down, he says, I've never told anybody this. And he proceeded to tell me about his abusive, a sexual abuse assault when he was 17. So he came in as a jaw client, but he left as a pelvic floor client because, you know, they're so connected.
Yes.
And, you know, that those kind of things. I had another client who happened to be a transgendered woman, and I was working on her pelvis, and she says, oh, and I said, what? She said, I forgot. And I said, what do you mean you forgot? She had forgotten that when she was 12, she had been in a rollover accident. Here she was a young male adolescent at the time, but the fractured high femur, was in the hospital for 6 weeks, body cast for a month. She completely forgot about that until we looked at posture and we could see the side bend, the rotation. When I touched her SI or her PSISs, that lit up for her. And she said, these are the same symptoms I was having as an adolescent. But she had set that aside because she'd lived through it already and had gone on with her life. So just the simple things of posture and explaining, why am I looking for what I'm looking for? It adds tie-in to what I'm going to do, buy-in to what I'm going to ask her to do.
Yeah. Heather, I know you and I have had many conversations around this over the years, but the body really is telling a story, and it holds all of those things in the tissues. And you know what I'm really becoming aware of, it's almost like the body has its own separate consciousness from our mind, you know, and we need to treat it as such. Because the mind, we can't treat the body from the level of the mind.
Correct. That's why I say I'm an eclectic and holistic manual therapist. I want body, mind, and spirit. Yes. And in order to do that, I have to be present for myself. So all the personal work that I've done that allows me to sit there. I had all the abuses at my house, you know, alcoholism, sexual abuse, oppression. And I've had to work through them so that I can be present. My job is to not have the client take care of me. My job is to be taking care of the client. And so I can share my story without crying. I can share the wisdom of my story, and that can bond me with my client in front of me.
Because you've done the work.
Because I've done the work. And it's hard work. It's simple. It's simple work. But it's hard. It is hard.
Yeah,
it is hard acknowledging all that.
Yeah, I have to say, I've done the work as well. And it allows us to, I think I say the most important piece we can bring to our clients on the table is compassionate detachment. And that we can only get there when we don't get triggered ourselves.
Exactly.
Showing up on the table.
And I would add, and curiosity.
Absolutely, yes.
So those would be the three that I would agree with. Absolutely.
Yes, that curiosity.
Yeah. So I always have a box of Kleenex nearby, but I never hand a Kleenex to a client that's in tears or about to be in tears.
Sister.
Because the box of Kleenex is a social cue to dry up, and I don't want them to dry up. I know they've got tears, I know they've got griefs and sadnesses that need to come out. And I tell them tears are welcome here. I consider them a sacrament of communication. Now, if they're starting to get really snotty and that kind of thing,
They can't breathe.
That's right. Then I'll hand them the Kleenex. But, as physical therapists, I've been told, oh, you can't work with the emotion. It's like, you can't
How
not.
can you not?
You cannot not. Absolutely.
Yeah, absolutely. And that's another reason that we ourselves need to be comfortable with emotion.
Right.
Because if we're doing our job, it should come up. It needs to come up. So
absolutely.
And
go ahead.
I love the tissue thing because it's, like I see it in my class, when I'm doing a demo on a student and doing the work, and it's so funny in my postpartum classes, I always try to do a demo to bring all the techniques together to show them how I do that. And not once has it worked out for me to do just the postpartum techniques, because the person on the table it's all trauma. It's all, their birth, we're replaying the birth, and the emotion will come up and a student will run and grab the tissue and, give it to the person on the table. I'm like, no, let's let that.
So allow them that. Mm-hmm.
Yes. Yeah.
And sometimes I will massage it a teeny bit. I'll say, and you just wanted to have a baby, and then the tears will come. Or, oh, I see how you have suffered, and the tears will come. Yeah. And sometimes I'll just sit with them. If there are times that I might sit next to them, often usually I'm sitting across from them, but sometimes I'll just sit next to them. Sometimes I don't volunteer easily my arm around them, because sometimes that's not what they want. But over practice, I've learned there are times just I get a little closer, I just be present for them and be in my own skin, my feet on the floor, my butt in the chair, so that I don't spin out in my own head, but that I stay present in my own body, so that my own intuitive knowing, my heart compassion, my integrated brain can be of service to them in that moment.
Heather, do you ever feel in the body, like in the tissues, where that someone's been through it, like maybe they haven't verbalized it, but you put your hands on the body and you just like, whoa, you get that this body's been through a lot, this tissue has been through a lot. How do you sense that in your body? Because I know how I sense it. I'm just curious are you aware of?
Often, well, tension is always one of the easiest ways, but energetically, there's usually, it can come like a buzz that's pushing off their body because they're tired of dealing with it. Yeah. Sometimes it's a stoicism of the tissue. They're braced.
Yes.
They are just braced against their own body, the world, the belief systems that are out there.
I feel it's kind of like the body's holding its breath.
That's excellent. And we certainly see that breath holding.
Yes. For myself, when I put my hands on the body and the tissues, I get this deep gut knot, not a knot, but just a like, wow, this tissue has been through a lot. And luckily for me, it's not something that just stays. It just kind of like hits home and then leaves. But it's just that awareness for me to go, okay, this is where we need to focus. There's a lot going on in here. So, okay, let's be a little sensitive. Let's be aware and work with this. So, yeah.
Absolutely. And then, it's general listening, people will, those of you that have taken visceral work, I certainly would highly recommend it, because it allows you to feel into the tissues, the pulls in, the releases. I think that's a great hand skill set.
You mentioned general listening, and you learn that in a visceral course where you put your hand on the top of the head, and the head will go into the fascial pull where the body wants you to work or be aware of. So it might go to the left, to the right, front, or back. And then depending on how much the head pulls down will give you a sense of where it's located in the body. So
exactly. And to be able to feel and follow that pull all the way down into the body. And of course, if they fall back or fall forward, that's an indication that they're living in the future, living in the past, or that something about them is also impacting that general listening.
And then also when they become out of balance and you inhibit the third eye, so right above the eyebrow in the middle, that and that stops them from swirling around, it's an emotional issue. And funny enough, I was working on a friend of mine, and I have to say, family and friends, it can get a little tricky because you're, you know, really challenging to work on family and friends. And she was swirling, and I did the inhibition, and she stopped, and later on the table, and I still went into the physical and tried to work with the physical, and it kept like moving all over the body, and it would release, and then something else would come, you know, and it was just like chasing me all over the place until we finally got to the emotion.
Yeah. And people are ready at different times, you know.
Amen.
I always include in my eval questions, have you ever had any physical contact against your will? I keep it as general as that. I'm looking for the clues, the nonverbal as well as the verbal cues. Many people will tell me, yes, they have. And I ask, have you had counseling around that? No, they haven't. Then I certainly encourage them, because of the work we're going to do, that we're going to want that together. I'm a physical therapist. I'm not a counselor, but I will tell you, people will say you're the best counselor I've ever had, mainly because I'm willing to listen to them and they feel safe with me.
Yes, yes.
You know,
and you're being guided by the tissues too.
Yes, and I have to be present moment. I have to deal with it, you know, in the present moment. But I'm also looking for the nonverbal cues. Oh, no. I'm thinking, okay, that's fine. You know, I've had people come back later, or they ask. If I see that, I might explain why that could be important. I've had people come back and say, I didn't tell you this, but now that you asked, and then it comes out.
Yeah.
So, and I have to be able to deal with that in order to give them the best treatment that they need and it can have.
Okay, so how do you treat that, Heather? How do you address that then?
I don't know that I have a universal. Oh, first of all, I'm willing to be present for them. Once again, if they have tears, and encourage outside counsel. But in the moment, I try to get them out of the story so much and more into what are the sensations in your body. That's Suzanne Scurlock's work, Healing from the Core, is you can only heal in the present moment. You can't heal in the past, and you can't heal in the future. You can only heal present moment. And so what are the sensations that are going in your body right now? Heat, cold, vacantness, hum, buzzing, tightness, blackness, colors, you know, flashes of pictures. That's tissue, that's a sensation that we can then work with. And many times it's just being present for that, to talk about it, to let it release. Is it resonating with another part of your body? Are there connections to your heart as well as your gut and your pelvic floor? So getting present moment is the best thing I can tell you. And I will remind them, okay, get your feet on the floor, butt in the chair, or if they're reclined, back against the chair, so that they can be more present, not spun out. And I'll share about that. You know, we need to get you down into your body.
Yeah.
And so I educate as I go.
Yeah.
But you have to deal with present moment. You can't, the story, we can go down rabbit holes. You know, we've spent lots of time, 40 minutes, listening to the big stuff. And there are times that that's fine. It's very appropriate. But I also tell them, you know, you can cry and talk at the same time, so that they can help get that story out. You know, it's very, each person's different. And having brought as much awareness as I do, I don't know that I have a one size fits all, but certainly present moment is the best we can be.
What do you mean by spun out? What does that look like?
I think they're in their head. They're not in their body. They're somewhere up there, spun out.
Yes.
And that's when I, you know, or they'll come in, for example, they'll come in and says, I'm depressed. And I will challenge, gently challenge any diagnosis. I'll bring that piece in too. I have this, or I have cancer, or I am this. I will gently challenge that over time. That I'll say, for example, if they say, well, I was really depressed today. And I said, you mean a part of you was depressed? Because the part of you that drove over here today, not depressed. The part of you that got dressed today, not depressed. The part of you that picked those earrings,
Yeah.
not depressed. And so I share with them about how their language will impact them. So even as a gentle exercise right now, if you say to yourself, I'm depressed, and kind of feel I'm depressed, like all of me is depressed. And then you could say, a part of me is depressed. And then suddenly it gets smaller.
Yes.
And not quite so big. And then if you add, a part of me is experiencing depression and I'm aware of it, then suddenly it's, oh, where in my body is it? Oh, it's in my heart. It's in my gut. Maybe it's in my throat. But my highest self is now available to look down or look into my body. Where is that and what is that about? So I bring my highest self to that part of me that is depressed.
I love that. I love that. Over the years, I have learned the power of our words and what we say, and the I am principle. So the I and then AM. So I am principle. Those are the two most powerful words in the English language. And whatever you put behind it amplifies.
Absolutely. So I like to say, when they say I have cancer, I say, let's cancel that.
Yeah, right.
A part of me is experiencing cancer,
Yes.
and I'm aware of it. And suddenly it becomes just X more manageable.
Yeah. Well, and I love the fact that you say, and I'm aware of it, because I think a lot of what we do with the body, Heather, is just help people become aware of what's being held in the tissues, what's being held in their body, help them to become aware of the tensions in their body that they're not, because so many people are living in their head.
Exactly.
Well, so powerful. Y'all, if you're not watching this on the video, but you're just listening to it, Heather mentioned her earrings, and her and I, look, we're so connected. We almost have identical earrings on today. Like, we really could be twins, couldn't we? Like,
could be.
We think alike, we act alike, we, really have very similar interests. And
sisters from another mother.
Yeah, sisters from another mother, for sure, for sure. Okay, so any other golden nuggets you want to share, Heather? I know you have 5 pages worth, so
it's true. Maybe that we'll do further podcasts. Well, I always include questions about the jaw. In our practice, 60 to 75% of the women, and now men, that come in for pelvic floor have jaw issues. They've been clenching, and the connection between the jaw and the pelvic floor is immense. Just thinking about the mandible that crosses midline, the sacrum crosses midline. We're the start and the end of the alimentary canal. We've got estrogen receptors in the joints, and Elizabeth Noble, that beautiful Australian physical therapist who taught one of my first classes, said, the truth you don't speak on during the day, you chew on at night, you grind on at night. So I just find it very, very common, and very few people don't have a reaction when I share that. The clenchers, and it's another way we brace against the world. And then the other was that what the upper lips won't say, the lower lips will. So when we don't speak our truth during the day, that's a piece of potentially pelvic floor issues as presented. I mean, it's not like, but I've had beautiful, beautiful young women who we get them ready to have ready to have penetrative intercourse again. They don't want it with that guy because they finally figured out who they were. They're telling their truth. But jaw is really an important piece of pelvic floor work.
So what are some of the questions on your questionnaire about the jaw that you're asking?
Oh, do you have pain, clicking, popping? Are you a clencher?
Okay. Yeah.
Do you have headaches, migraines? Posture is really key in that, but with the amount of tension that we hold in the cranium, muscles, that has an impact. And the other interesting thing about the jaw is if you're working on the pelvic floor, and this is true for laboring women, if you can get them to relax their jaw, that can be a big help with relaxing pelvic floor. So in our clinic, we use biofeedback, and I always did biofeedback on the jaw first, because if you can learn to relax your jaw, you can take that skill set into the pelvic floor or internal work when there might be pain. And so the jaw is really easy to get to, putting electrodes on. They can see the impact of posture there, and physiologic quieting. That would be another big piece. So those are questions I ask in terms of tension. Are you a breath holder? We can take I can say, okay, let's count your breath for the next minute and just see where they're at, and know that they are not able to be in that physiologic quieting spot. And that's part of the jaw, because we tend to hold our breath, clench, brace.
Yeah. Wow. Okay. Way cool. So the jaw is so important. I'm curious, Heather, have you ever done intravaginal work and then just had someone focus in on the jaw to feel the relief?
Oh, absolutely. Well, when I do that, we have done the jaw first before I ever do internal work. Okay. We will do relaxation on the jaw. I'll teach breath work. Now, I've already done some external manual therapies, SI and bony pelvis, which we'll talk about a little bit later. So I always do that first, but I always get them to know relaxation, so that when they're on the table, I can say, okay, I want you to focus on your breathing. I want you to soften your jaw, soften your fingers, soften your toenails, soften your eyeballs, and come back to that if at any point there is discomfort.
Okay.
Because I'm a lot of women have discomfort with any kind of penetration. But I want them to know that they're in charge of it, that nothing goes on in that room without their permission, that all they have to do is tell me stop, and I will stop, get out, and I will get out. Yeah. I've taken 40 minutes to get into a vagina or a rectum.
Yeah.
Because I'm willing to slow down, take my time, watch them, watch their breathing, get them more centered. I had one woman, it's 40 minutes. She just got tears, just little tears. And I said, can you tell me what the tears are about? She says, because you're taking your time and you're gentle.
Oh.
Her husband had brought her in, determined to be able to have intercourse, and he had been putting hot dogs vaginally, trying to force them in so that they could ultimately have sex. And she just sat there so stoic during the interview. My red flags were just going, how controlling he was. But when we had our one-on-one time together, and she was able to drop in and soften, and
Wow. So amazing and so important. I've had a couple of experiences with my clients where, doing the work, and we got to a point where they were done, right? But it was like, I could sense that it was going to be really empowering for them to tell me to stop. Right. And, and so they kind of sheepishly said that. And I go, okay, I need you to really say it with power, say it like you mean it. Right. And then I, listen to it, and there's like, oh, that they're in control of this area of the body. Right.
I work really hard to empower my clients. I ask them, we too will practice, and it may be just putting my hand on their shoulder and saying, would you please take it off? That doesn't feel right. Or I'm going to put my hand, if it's okay with you, obviously, but I'm going to put my hand, and I want you to say, no, thank you. That's not good for me today. And we practice those words so that they can feel safe.
Yeah, absolutely. So important. And yet not every client needs that.
Correct. Oh, absolutely.
And
absolutely.
So I think, for us as therapists, we need to be able to really tune into our clients to be able to get a sense. And it's that subtle nonverbal language where I think you and I are picking this stuff up. To be able to really hone in on allowing our clients to get that experience And so for a newer therapist, any words of wisdom on how to really listen into that or to know that?
Mhm. First of all, do your own work.
Yes. Yes.
That's probably the most important. I find that the more grounded I am within me, that the easier it is to see it in other people.
Oh,
And so it's not my own distractions. I don't have my limiting belief systems getting in the way.
Yeah.
That's not an easy task for new clients. I mean, I've had clients that were unhappy with what I did. When I was younger, I was brasher. I thought I knew better. I knew what their body needed.
yeah.
I have found out I don't heal anybody. My job is to facilitate their body healing themselves. Dr. Upledger talked about the inherent wisdom of every single cell of the body. And
Yeah.
I absolutely, buy into that.
Absolutely.
I'm looking for the one cell that will release the other cells. Don't
Yeah.
always find it. And sometimes it's more than one cell.
Yes.
But for new therapists, do as much, the more gentle techniques that you can learn, healing from the core, visceral work that teaches you the softness, the ability to be present for the body that's in front of you, the human being that is in front of you. They're not just bodies, they're
Right.
human beings.
Yeah.
Keep working at it. If you're in this practice, if this is part of your life mission to be a healer, it isn't heal yourself first. That's the first thing.
Yeah.
And be present to allow others as a facilitator to heal themselves. It's a work in progress. It's a work in progress.
Heather, how long did it take you to really kind of appreciate your healing abilities? I know it was a journey for me because, physical therapists, you really do have to kind of unlearn that doing to the body approach that we learned, right? I'm going to do grade 4 joint mobs on the glenohumeral joint, and I'm going to do inferior and medial, and all this doing to the body. I think it was probably the visceral manipulation journey, right? That really helped us to be in the craniosacral too.
Absolutely.
Be able to listen to the body more.
Yes. I think the piece for me, I knew from when I was a young age that I wanted to go into medicine. So that was already there.
Yeah.
And I had a physician say to my boss, she's really holistic, only it was in a way that wasn't kind. And that hurt me. But back then, we had rooms were open. We didn't have doors. We had curtains. You could hear what was happening in the next room. So there was a limited ability during my early years to even be present and practice these skills. But I heard about this guy that was this internal medicine physician who was working on the coccyx internally. And I said, I could do that. I knew inherently that I could do that. And so the more work that I did and I did on a spiritual basis, this is spiritual work. We are asking to be invited into people's personal space. And to me, that is a spiritual journey. And so the reverence that comes to that and the touch. And I did a spiritual class where it's like, what is my life mission? And I'm healer, teacher, advocate, and witness. That's what I came up in that personal work. And so that's what I bring to my client, because I may be the first witness they ever have. There are women who they would tell their husbands they're hurting. They don't tell these beautiful young women. I asked this woman once, why do you put up with it? I asked her the pain. She says it was 7 on a scale of 10. I said, why do you put up with it? She said, because he said, if I'm not giving it to him, I must be giving it to somebody else. And I had to be able to be present for that. Yeah. And so, to witness to the heartache and the backstory that brings this body to me. But it was years, I had 4 children before I finally looked around and said, life is not working the way I wanted it to. I was a controller by nature. I can, as a birth mother, I was going to give it to you whether you wanted it or not, but my fourth child, I couldn't do it. That was 5 new relationships I had to control in my house, and it put me over an edge. And so I got into some really deep counseling, and it was that work really that freed me.
Yeah.
I did a lot of inner child work so that I can be present for that. So it was a journey.
Yeah. Yep. For me too. And I think, I've done that deep personal work as well, growing up with an alcoholic father and, codependent mom. And we all have our issues, everybody. We all have it. So, nothing to be ashamed of. And the more we can just own it and do the work to help, it's happened to us for a reason. So let's work with that reason and let's learn from it so that we can be better and do better.
That's right.
Yeah.
And I would say, I know we're getting close to our end for this part, but I remember one client I brought in on a Saturday. Normally I don't work on Saturdays.
Yeah.
I spent 3 hours with her. Normally my sessions are an hour. Every hard thing that had ever happened to me served me to serve her that day.
Yes.
And so I would never go back if I couldn't take the wisdom that I have hard-earned woman wisdom. I don't envy anybody else because they got their own backstory. Lynn, you had your own wisdom that I don't want guess what I'm trying to say is, I don't want to have to relearn anybody's wisdom. I've put in the work to learn mine. So I don't put anybody on a pedestal anymore. We're all just doing the best we can. And I'm grateful for the wisdom. I'm grateful for the lessons that I've had, I wouldn't want anybody to have to deal with what I dealt with. But as long as I dealt with them, now I can use them into the world.
And so that's such a beautiful point to be made, is that, we've had these experiences to help us along our way, to make us better people. And everybody has a story. And that story is held in our body and in our tissues. And I truly feel that it's our job as manual therapists to be able to learn to listen to that story and help the body tell its story. Like you said, being that witness, being the listener, and respecting whatever is coming up for that person. And it's not ours to take on, everybody.
Correct.
You've got to do the work so that you're not taking on other people's stories, because it's not yours. And we need to be grounded and centered in ourselves so that we can better serve our clients. And Heather, thank you so much for everything that you've shared with us today. I know we probably only got to a third of one page of your 5 pages. So we will be doing more for sure. So everybody can look forward to that. And also Heather is going to be a part of the Birth Healing Summit this year. And we're going to dive deeper into her protocol or her approach to the sacroiliac joint, treating the sacroiliac joint. So I hope you will join us there so that you can continue to learn more from Heather's 45 years of gathered wisdom. So thank you, Heather, so much for being.
Oh, my pleasure. My pleasure.
So appreciate it. All right. And Heather is going to offer that a shadow ceremony as a gift. So please check that out in the show notes. Okay. All right. Thanks, everybody. We'll see y'all on the next episode. And here's to better births and faster recoveries. Take care.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.